Hi, my name is Amrit. I'm a student from Rutgers, and I'm here today to talk to you about medication-induced nutrient depletion. So that sounds like a big word. What exactly does that mean? So medication-induced just means caused by medications, and nutrient depletion just means low levels of nutrients. So basically, it's just a low level of nutrients that are caused by medications that we take on a daily basis. Our bodies rely on so many nutrients to function properly. They focus on roles such as making energy production, immune regulation, and bone health, and so much more. Some of the medications we take daily can affect the way our bodies absorb, utilize, and metabolize these nutrients. We can compare this effect to taxes in the real life. We buy things with money, and we pay a small tax associated with it. Similarly, our bodies need the medications we take daily, but we pay a small fee, like a tax, in the form of nutrients that our body uses. So we can work against this effect by making sure we're maintaining the balance of nutrients in our body, as well as taking supplements if we need to restore that balance. So why is it important to talk about medication-induced nutrient depletion? So while the medications we take every day for our underlying health conditions are important, it's also important to make sure that our nutrients are also in check. So depletion of these nutrients can lead to other problems like fatigue and muscle weakness. Like we all know, vitamin D is very important for bone health, and magnesium is really important in energy production. So it's important to prevent these deficiencies before they occur because they might prevent any adverse effects you might experience from your medications. So what are some common medications that can cause this effect? So some medications that you might commonly see that you could be taking are proton pump inhibitors. These are used for things like heartburn and acid reflux. This medication can actually cause a depletion in vitamin B12 and magnesium. Another medication that you might see commonly at your house could be diuretics or water pills. These you would take to get rid of excess fluid, and these can actually cause the effect of lowering potassium and magnesium levels. Another medication that might sound familiar are statins. These are cholesterol-lowering medications, and they can deplete levels of an enzyme called coenzyme Q10, also known as a supplement CoQ10 that you might have seen. And lastly, some antibiotics that we might take for infections can cause lowered levels of vitamin K, B, and as well as affect our gut microbiome, for which you might have seen probiotics over the counter for. So what can we do to prevent and correct these deficiencies? So first off, we want to make sure that we're taking in a very balanced diet, including fruits, vegetables, grains, proteins, and healthy fats. This is important to make sure that we're actually intaking the nutrients that our body needs. The second step would be to make sure we're staying hydrated because we're taking in these nutrients and we want our body to be able to absorb these nutrients. So staying properly hydrated throughout the day is very important. Lastly, if a supplement is needed, make sure that you are checking with a doctor to make sure that you're taking the right supplement and that you're able to take the supplement. So for just some of the common medications, if you're taking a proton pump inhibitor or a diuretic as we discussed earlier, I would highly recommend to take a general over-the-counter multivitamin, as well as if you know you're taking a cholesterol-lowering medications, statin as we discussed before, I would highly recommend taking a supplement called CoQ10 available over the counter. Okay, and like always, make sure that you consult any of our pharmacists here at HB Pharmacy for any questions you can have and to find out which supplements are right for you.